Hi friends, I have the honor to introduce to you Dr. Vishnu Koneru. He is a PGI 2018 May exam rank 27.
Thank you, sir.
Heartiest congratulations.
Thank you, sir.
So how are you feeling today on this awesome achievement of yours?
I feel very happy and I think more relieved than happy because, to be honest, it was a good slog for the last 12 months at least of the, 18 and finally relieved and happy. Yeah.
Yes. So relief first, then happiness sinks in.
Yeah, yeah, we can say that.
Uh,
Yeah.
so, and on this moment when you have done so well in a central exam like PGI Chandigarh, where many people would say that these are the topmost institutes in the country, AIMS, PGI Chandigarh,
Yeah.
and now you have an opportunity to enter into a post graduation in this kind of a program.
Yes.
I would say it's a landmark achievement, and
Thank
I
you,
would
sir.
like to congratulate you, your parents on this
Yes, sir.
day today.
Yeah, thank you, sir. First of all, I would like to thank my parents because in India we obviously take a lot of things for granted from our parents, but uh, and we don't thank them enough. It's maybe feels a bit weird to always keep thanking them, but uh, I don't know. I don't have the exact words, but really grateful. That's what I can say.
I totally agree that in India our parents they kind of form our backbones
Yeah.
and they keep doing it, and that is what India is all about.
Yes, sir.
Family
Yeah.
maybe.
Yeah.
Yeah. So now on this note, I would now I know you for long. You've been a foundation student, then you followed up with a test and discussion and a test and discussion. So you've been with us.
Yes.
So how was your experience when you entered the foundation course for the first time? Was it like your initial exposure into the competition, and how was your exposure into the test and discussion? What was your experience with us?
Sir, initially I was apprehensive about what this new PG entrance is because we almost just maybe it was 2.5 years, but it was almost just out of PMT and another exam was beckoning and kind of scared also, I guess. But uh, once I heard first about an institute like DAMS, I was first of all relieved that there is a such a good guide that to help us in the exam. And then when I attended the foundation course and had my notes, obviously I wasn't very regular in my first foundation, but some of the notes I made, I had later on also I had the best confidence in those subjects which I had the notes. And yeah, obviously even at the end the notes were the main thing. I'm not someone who can actually go through all the guidebooks. There's a lot of difficulties with the guidebooks, edition by edition, so much info, and it's very difficult to revise. So they were the main base, and almost that's the thing I read. So yeah, also later TND I mainly focused on the weak subjects in TNDs and attended the weak subjects, and they were really very useful, sir.
So did you find the approach different when we were teaching you in foundation, because we are teaching young kids,
Yes,
so
sir.
we are very smooth,
Yes,
gradual,
sir.
we keep telling, and when TND is more competitive,
Yes, sir.
you have to test and the ranks are displayed.
Yes, sir. Yes.
So did you enjoy the change in the style that when you go into the internship, we change the style?
Yes, sir. It was actually more useful, and it's also you also keep in mind that the people have attended the foundation, so at least the real bases are covered, and so that really helps. I mean, it's almost like a continuation along with the revision.
Yeah.
So that's really nice.
Any particular teachers that come to your mind today? Any particular subject teachers that you can recall that okay, you were happy to attend their classes or
First of all, you, sir, apart from radio diagnosis as such as a subject, in life too, you have been a real inspiration. And
so kind of
if there was a doctor who I aspire to be, it would be you.
kind.
And obviously for the other subjects, there are a lot of nice subject, and all the notes, especially Deepthi ma'am's notes, there is no replacement. And all other subjects, CCM, Siddharth sir, and actually, I am forgetting the names, actual names, but
I can.
Yeah, but
Maybe the
it was,
subject, if you mention, it's okay. We understand.
yeah, I have a slight aphasia with names.
I
Yeah.
understand. And so with that, when this has been, kind of your strategy. But did you add grant tests to your strategy as well?
Yes, so grant tests were the main core of everything I did, because I personally, like, I am motivated also by tests and everything. Even some might feel कि मतलब अगर grant test दे दूंगा तो confidence कम हो जाएगा, but to be very honest, it's a lot of times it's the opposite, because if you give the grant tests, maybe you haven't read it, but once you give it, you get a particular rank or a particular mark. You'll know that you're here and you can improve. So it's not like ki, at least you know where you are. Otherwise, there's that uncertainty, that confusion, which might lead to a low confidence. And I would always advise you to give more and more tests, if weekly, if possible.
How was your approach with the grant test? That, like, did you after the test look at the video solutions? Did
Yes,
you
sir.
look at your mistakes?
I was a bit late in realizing there were video solutions. So when I realized, I was very surprised and went back to my old tests and saw the confusing answers, solutions, and all. It's really amazing, and I was actually very pleasantly surprised that it's so good, because I didn't expect it, the video solutions to be there. So it's really nice.
This year, what we've done is, even in the study material this year, because you have always been the kind who's interested into new things.
Yeah.
So, that spurs me to talk about that. This year, we have introduced videos on each chapter of the CRS books as well. So
Okay.
there is a teacher guiding you that how to read the book, how to read the theory, and this is like I believe that when a teacher is talking to you, you retain more
Yes.
than paragraph written,
Yes.
long paragraph with multiple
Yes.
references. And
Yes.
so that kind of thing I keep trying to do. That where I want to be there in your mind when you are appearing for the exam.
Yeah.
So that is my aim that I want to try here. And I also want to know from you that were you happy with the fact that teachers were approachable? You were in the Facebook group.
Yes.
They were on Facebook.
Yes.
They were studying together, joking together. Were you
Yes.
happy with the entire thing?
Really happy with the Facebook group. Also, very happy with even some of the teachers. Most of the teachers replied, on personal messages too. Like almost all of the teachers, and even the group. Obviously, everyone is active, and all the doubts are like regularly cleared. And also, if someone else puts a doubt, and it might be a doubt I had but forgot to ask someone, that was really helpful.
That is very important thing that you pointed out. Sometimes you forget your doubts.
Yeah. Yes.
It is very important that, but someone else might have that
Yes.
same doubt. That's
Yes.
a very important thing. Yes. And so you've been doing these all things, but then how did you put them all together for revision later on?
Sir, my strategy from the beginning has always been to read limited, so that my last 40 days or 35 days, I can culminate all what I read, because otherwise there's a lot of things going on at the end. Although it's tough to revise, but at least you have the confidence that you have read repeatedly what you have read before. So that's been always my main strategy, and obviously it's a known fact, revision is the real deal. That's the deal maker or the breaker. It's maybe some people may be able to do it with their previous knowledge in their MBBS course, but a lot of people might not have read so much in their MBBS. So for them, I think it's surely the best strategy to read limited and repeatedly revise the same.
So it's actually more important to be doing a guided thing with the selective study,
Yes,
rather
selective
than
intense.
in the end, in 6 months you try to do the comprehensive thing with trying to look at all the textbooks in 6 months and messing it all up.
Yes.
Because by the end what happens is you get less and less time for the exam.
Yes.
Like if you look at the last November aims, if somebody doesn't do well and he wants to do well in the May aims,
Yes.
there is less 6
Yes,
months. In those 6 months, 1 month goes in finding out what went wrong.
Yes.
Then so it has to be smartness in your
Yes.
study that actually pays back. So I also want to know from you that you've done so well in an exam like PGI Chandigarh, which is slightly atypical.
Yes.
Like a PGI has a different style altogether as far as all other exams are concerned. And so can you tell me, what do you feel were the differences when you appeared for the AIMS exam this time?
Yes.
And the PGI exam this time?
Yes.
And what did you tell yourself before the exam that, okay, in this exam I will try to do like this?
Yes. Sir, the AIMS exam is very clinically oriented. Also, it tests tough concepts. It twists the questions. But one thing about AIMS is that it like tests specific topics, and sometimes it tends to go into specific areas. PGI is very broad. It tests almost all the topics, and also all the subjects has a particular weightage. You know how much subject is coming, how much. In AIMS, maybe 1 year obs gynae a lot, 1 year ophthalmology a lot, 1 year lot of emergency medicine.
Yeah.
But here you know how much it's coming, and also I think PGI, the strategy is particularly important, because that can make your rank jump a few places, because not everybody might know the strategy, so that's where maybe you can improve. Yeah. So
What was your strategy during the exam? That how many choices did you mark?
yeah, I had attempted a few previous exams. I had actually sat down and done the exam. I might not have read all the solutions, but actually sat down and done a few exams. So, and also I just saw the answers. I didn't see the solution. I just saw what they were trying to do with the options, how many they were trying to do. Like one particular point I'd like to point out is that a lot of times in usual exams, maybe an option says ki 5% of this thing, 5% of these many vaccines, or something like that, some number. A lot of times we tend to think that it would be right, because in an all except question, or we tend to do it right, we think that it's right. But in PGI they want us to think that it's right, and a lot of times it's false.
The value is
Yeah, the value is actually wrong. We might never imagine ki that guy is actually wanting to test us based on this
percentage of side effects and this percentage like this.
Those might actually be wrong a lot of times. So tricks like that, even maybe 2 or 3 exams you do, and you can realize those tricks. And also attempting options, I obviously went with the safe thing, attempted less, as only the more than 60-70% sure ones. That was my main strategy. Yeah. And obviously focus
like
during
maybe if I look at people appearing for AIMS and PGI, I see most people go a little bit more guarded on PGI.
Yes.
Because of the higher penalty in the negative marks, and they become more aggressive in the AIMS.
Yes.
And probably that kind of sums it up. And
yes, sir. It's almost in PGI. I think they say it's about 550 right options and whatever 700 wrong options. So they are in the denominator. So it's basically approximately plus 1.1 and minus 0.9, and in AIMS obviously plus 1.33. So obviously AIMS, it's a bit aggressive approach is okay.
Yes. How many did you attempt when you were appearing for your AIMS exam?
In AIMS exam I attempted 192, sir.
Yeah, which is I think the right thing
yeah.
to do. I think that is the correct thing to do.
Yeah.
But it's like just say like that you have to give yourself the best chance,
yes,
by attempting
yes,
on a higher
yeah,
side, and I think that is the right strategy to do.
Yeah.
And anything else that you would like to give as an idea about a topic, or a area that you feel that a person appearing for the November exam should look at?
Sir, I really feel for AIMS you should have a balanced approach. Like although my AIMS rank was 190, so almost the same as what I got in November, it was a bit weird because I actually left a bit of, almost not a bit, but I couldn't revise obs gynae well this time, and I went with that chance factor or risk, and obviously it didn't. It was tough on me. But that's what I feel ki AIMS, you should be balanced in all the subjects, because anything might come. There's no particular pattern ki is subject mein itna aega. So you should be balanced, although you might miss out on a few extra facts, but at least cover your bases in all your subjects, and then go. I mean, maybe a trick you could do is that keep your last week for something else. Last week just before the exam for some high yield topic like DVT or something, and finish your syllabus before that 1 week. So even if it extends, then the DVT can be incorporated behind, and you can do stuff like that, but finish all your subjects.
Yeah, what I actually appreciate, about your advice is that, that everybody needs to understand this, that there are no guarantees in the exam.
Yes, sir.
That sometimes, somebody might say, in AIMS, this is not going to come.
Yes, sir.
There's no such
Yes.
guarantee. Next
Yeah.
time, the other subject might have more
Yes,
weightage.
yes.
And you might end up, because of those 5 questions,
Yes, sir.
you might end
Yeah.
up losing your dream.
Yeah, yes, sir.
So there are no guarantees in such exams. These are
Yeah.
central exams, highly competitive.
Yeah.
People want to reach there.
Yeah.
So the exam body tries to shuffle
Yeah.
so that you don't
Yes.
outsmart them.
Yeah.
So we have to be good at all
Yeah,
subjects. That is
balanced.
his message, and that is a very good message that you've given. Very, very good message. And second thing I like about his approach, he said target a week before to finish off.
Yes, sir.
So
Yeah.
give yourself some time
Yes,
after
sir.
that.
Yes,
Yeah,
sir.
it's very good.
And one more thing, because obviously I like my mistakes are more useful for those watching, because obviously they should avoid them. So one thing I'll tell you is ki don't keep the main core hard tough revision topics at the last day. Like someone might keep biochem micro on the last 2-3 days. So by chance if the schedule extends, then your most important things are gone and you lose almost all your marks of those subjects. So that is one more thing I'd like to add. Is
I think those are golden words and golden advices that you have given. I think future aspirants will benefit from your discussions, and I think many of them would already be writing down what you're saying. So I think we have had a good interaction from you. Now I also feel that success is not only just about hard work, just about strategy. It also is about the mindset.
yes.
So to build that mindset, I want Dr. Vishnu Koneru now to say a motivational line for future aspirants, and tell them something that kind of fires them or maybe motivates them to work harder.
I'd say ki stay confident. There'll be a lot of people who are confident, but they might think ki confidence to hai, but that's the main thing. Once you're confident at every point, it helps you, it drives you. Because there'll be times even in the most confident students head ki agar nahi hoga to kya hoga, but I mean obviously think that if you can't do it, then nobody else can, because everybody has the potential. There's no doubt about that. There are so many examples you might know from your college or anyone. So confidence is a major game for in this exam. The rest of the thing, I think everybody knows ki revision, smart study. Yeah.
I would like to add here is that he said कि अगर आपके मन में आता है कि अगर नहीं हुआ तो क्या होगा. So every time that thought hits you, start converting it into अगर हो गया तो क्या होगा.
Yeah.
You have to keep balancing. The negativity will keep coming back to you. You have to know this. It is unavoidable.
Yes.
It comes to even the best of the people.
Yes.
Then you have to keep telling yourself that what if it happens.
Yes, sir.
And then you start motivating yourself with the positive reinforcement.
Yes, sir.
So with that note, I again wish you all the best.
Thank you.
I convey my regards to your parents
Thank
and
you,
family,
sir.
and I'm really, really, really proud of your achievement.
Thank you,
Heartiest
sir.
congratulations.
Thank you, sir.
Congratulations.